Good day, everyone, and thank you so very, very much for joining us once again and I should say, speaking with Sandra L. This is all about the patient experience, and the patient experience a lot of times includes the patients, of course, because we as patients, we're the key factor. When we have providers working with us, we are the key factor, and we need to remember that when it comes down to that power structure, that all important tool that we have, which is our voice, it needs to be used because we do have providers, clinicians who they really want to help us. They want to be able to help us to make sure that we're living our best lives, that we're receiving the optimal health care that we need to receive. And so they're doing their all to make sure that patients are treated as that key factor because hey, really without us, how could they do their work, right? They're in a business to treat patients, but if we don't go to them and we don't ask them and we rely so much on Dr. Google and Mr. Firefox, which I pray people please stop using it. And I understand, you're like, well, Sandra, when I go to the doctor, they're using it. Well, yeah, they may be using it, but they know what is a valid source, what's a reliable source, what's a factual source. They know that 90% of the times, and I'm giving 90% of the times, and you might be like, Sandra, that's way too high. No, it couldn't be that much. But there are a large amount of people who go on Facebook, or not, I'm not even going to say Facebook, go on the internet and they look for Dr. Google and they go to Mr. Firefox and many of the other, centers that they can go to find out information, not realizing that that information that's being put into the system is not factual. Not realizing that, hey, there's options for me that I can, if I don't like a traditional doctor, I can go to what's classified as a non-traditional doctor. I call them the traditional doctors as well. But there are options. And so we have to start relying on what's factual, what's data, who can help me, and the number one person that can help any of us is our doctors. So this podcast is not to bash the doctors and not to say, hey, the patient experience, I'm going to call and I'm going to complain, or I'm going to complain because this is not what I'm feeling is not right. That's not this type of show. That's not this type of podcast. This type of podcast is to help patients. And when I say patients, I'm also talking about the patient network, such as caregivers, family, friends, community, to help them, to help us to get the best healthcare that we can get, to learn how to look for what's truth and what's not truth, to tear down some of these barriers that we put up when it comes down to going to doctors, and to help us find providers who care about us, who are like, you know what, I want to actually share my thoughts because I care, and there's some things that patients need to do that they aren't doing. And that's what this space is for. It's for us to actually get on that track of being patients that are doing our part and being responsible for receiving that better health care or that best health care. So today with us, I have a lovely Dr. Tramayne. I'm not going to tell her whole name, so she could do that when she introduces herself. But we had a lovely Dr. Tramayne Butler-DeLong. I said I wasn't saying it, but I did. I'm going to let her go ahead and tell you what she does so that she can actually tell you, we can get into the conversation and she can tell you what she needs you to know when it comes down to what, once again, is so wrongly classified as non-traditional healthcare. So without further ado, Dr. Tremaine, can you please go ahead and introduce yourself?
Yes, hello. My name is Dr. Tramayne Butler-DeLong, and I am a cultural anthropologist as well as a Mayo Clinic certified wellness coach. I'm also founder and CEO of Anthropology LLC, which is a holistic health and lifestyle wellness brand and company. And we help people feel better inside and out by developing wellness tools and innovative wellness solutions that are holistic and based on traditions from around the world. And so I have infused sort of all of our wellness tools and solutions with the science of anthropology and relying on my background in cultural anthropology. I've taught for over 20 years as an adjunct professor in the social sciences on various topics in anthropology and sociology, including different culturals topics like Native American cultures, African cultures, Latin American cultures, as well as in the Masters of Public Policy program, research methods as well. Most recently, I taught at Case Western University and the entrepreneurship program, developed a course on sustainable entrepreneurship for the Weatherhead School of Management. So I basically used my academic background and a lot of the research that I've done over the years on culture to apply to my business, which really focuses on using some of the holistic wisdom to develop these tools to help us feel better, both inside and out. We started with our clean beauty line. So I developed the 100% natural clean beauty skincare line, which combines ingredients from 6 continents around the world, all natural ingredients that have been used medicinally and holistically to improve one's skin without any harsh chemicals. And I was really inspired to do this because I'm also a busy mom of 4. And one of the things that I like to do is to go to spas to rejuvenate myself. And I found that there weren't a lot of all natural products that were really effective and really gave me the anti aging effects that I really wanted. And so I developed or decided to develop my own skincare products and using this idea of anthropology and the science of anthropology as well. And so now, we have that product line, but we also just launched a digital wellness academy, which is an online subscription based program that gives people the tools and resources and helps them really to create a roadmap to their own wellness, to help to prevent chronic diseases, to reach their wellness goals. We really want to help people to improve their nutrition and fitness levels because ultimately this will help to prevent or manage chronic diseases like obesity and some of the related things that come along with that, like hypertension and diabetes that people may be suffering from. And so I became certified as a wellness coach by the Mayo Clinic to really provide people with a more holistic wellness experience and to sort of create an opportunity to give them the tools that they could use to improve their overall wellness and health and well-being. So we have the Digital Wellness Academy. It's really designed for people over 40 who want to get their energy and vitality back, helps them to teach them the right combinations to eat in terms of foods to boost their metabolism, as well as to reach their wellness goals in terms of their energy and reduce your stress levels as well. So that's the Metabolic Renewal Wellness Program. And then the third thing we do is we work with organizations who want to start their own wellness initiatives. So we do that through consulting as well as through workshops that I've developed that I will provide at different organizational events as well as corporate offices. And so one of the consulting clients that we've worked with is the University of Illinois, and I've done a lot of work with a colleague there who's a dean at the College of Medicine. She developed a youth wellness initiative that was funded by the MacArthur Foundation and the National Science Foundation. So we helped train youth as community health workers. I developed a lot of curriculum around that for the youth to go out into their community and be resources to help them navigate the healthcare system and improve their health outcomes overall. So we train the youth age 16 to 24 to be community health workers and also develop wellness centers to put in CPS, Chicago Public Schools. So we put 2 wellness centers in the schools as well as We're currently working on a cookbook together that will focus on using food in a medicinal way to help to prevent chronic diseases. So, those are some of the different things that I've been focused on from my for profit side. I recently launched a nonprofit called Transformawell, which is a 501(c)(3). And the nonprofit is really focused on outreach and education in underserved communities about healthy lifestyle changes they can make to prevent chronic diseases like cancer, obesity, hypertension, diabetes. So we do a lot of outreach in churches, schools, local organizations. We partner with them and teach people about changes they can make that can make a big difference.
See, all this in one beautiful black queen and more. I'm going to say this once and I'm going to repeat it at the end. She is also a partner with Charms MEDI-HELPZ Foundation in the upcoming October 25th wellness summit that we will be having on the west side of Chicago. So if you're in Chicago and you like, you know what, I want to know more about the summit, I want to know how I can participate, what I can do. We actually topped our list this week with 10 different speakers. So we have 10 different speakers that will be speaking on everything that we don't know about our community and health conditions that are ravaging through our communities in ways that we can actually benefit. You can actually benefit yourself by learning about this information. So we topped out at 10 speakers and now we're looking for vendors. So if you're a vendor and you're in the STEAM fields, and so when you say STEAM fields, what is STEAM fields, Sandra? Science, technology, engineering, art, or math. If you're in any one of those fields and you have a service or you have a product that you're trying to get people to know about, what I would suggest you do is actually outreach me and say, hey, Sandra, I'm really interested. How can I get involved or how can I be a vendor at that space before the vendor spots fill up as well? So, without further ado, I'm going to go ahead and start asking Dr. Tramayne some questions. But once again, Chimes is dedicated to making sure our community learns what we need to learn and understand what we need to understand when it comes down to healthcare. Chimes MEDI-HELPZ Foundation is not a medical provider. We are a healthcare resource and research nonprofit. What we do ask you to do is if you have a question, once again, skip Dr. Google and Mr. Firefox and go to your provider. Dr. Tremaine is a provider. However, she's not in the clinical space. She could be very, very helpful for you to have a relationship with, and as far as learning what you can do culturally and learning what you can do, with your body and through exercise and through eating directly. But she's not your primary care doctor. Reach out to your primary care doctor, start having these conversations and start asking about the things that you're hearing on the podcast so that they can actually answer those questions for you. But as a disclaimer, do not take our information that we're discussing and use it as your replacement to talk to your doctor. Please, please, please be encouraged, empowered, and engaged in your own health care and speak to your doctor. Dr. Tremaine, let's get to the good stuff. How
Yeah.
does speaking different languages or having different ways of talking cause problems in getting good health care?
Well, that can cause several issues actually, and it's interesting because it could be a whole research area of study for someone who's interested in linguistic anthropology. And I was actually trained in the four fields of anthropology, even though I'm a cultural anthropologist. And linguistic anthropology is one of those subfields. And it would be a really interesting issue to look at how language affects sort of these relationships and some of these communication problems in healthcare. it can definitely lead to a lot of issues. And one could be just misdiagnosis based on misunderstandings between the provider and the person who's trying to describe their symptoms. Also, it can foster a lack of trust. If your provider doesn't speak the language that you speak, then it could not make someone very confident in their recommendations, because that trust factor could be affected if there's a language barrier there. And also, it can provide a poor follow through for the person who's seeing the doctor. The patient may not understand completely the instructions for the medications that they're supposed to take. And so they may not be as compliant with those medications because this language barrier exists in terms of the instructions that are given to them after they see their provider. And it's interesting because this actually affects quite a few people. In fact, many people are considered limited in their English proficiency, and it can lead to poor health outcomes. And people are less to actually visit the doctor. Actually, I mean, there are statistics that are saying that people prefer not to go to the doctor at all, if like 86% of people, if they're not proficient in English and they're not able to understand their providers. So there can be a lot of confusion, that's caused between the provider and the patient in those instances. And according to Nurse Journal, 49% of patients with language barriers actually reported physical harm, and 47% experienced moderate to temporary harm. And so these are real outcomes that people are experiencing due to miscommunication within that sort of space.
Thank you so much for answering that question. And that's very, very true. A lot of times, when you go to the doctor and they're really not understanding you, it's hard for a patient to go back to that doctor, right? And so instead of them going and seeking out another doctor, they just say, I don't want to get health care at all. I don't have time for this. Or, this doctor told me this. And a lot of times doctors tell us things and we don't understand it, right? Because they're not telling it to us in a language that we understand. And so
Mhm.
we really don't understand it. So thank you so much for addressing that point, because it is important for us to know. And one of the things as a patient that you can actually do, if you're at a doctor's office and you're like, this doctor is just really not understanding what it is I'm talking about, and it's due to a language barrier, ask the doctor, is there anyone else in your office, an office manager or someone, medical assistant, that can come in with us during this visit, because I'm really not understanding what you're saying. Ask
Mhm.
for that help. Don't just sit there and say, okay, well, he's really not understanding what I'm saying, and getting really upset because he or she is not understanding what you're saying, and not ask for help.
Mhm.
Normally there is someone in the office that can help to make sure that you're understanding, not just hearing, because it's important for a patient to hear, but it's equally important for a patient to understand. The key, the word there is understanding. So if a patient hears and understands, they're generally tended to what we in the healthcare field know as compliant. They'll generally be compliant patients. But when you don't understand something and you don't speak up because of a language barrier, and you go home and you don't do what you're supposed to be doing because you might be upset the doctor said something you really didn't understand, or you left the visit without really understanding what the doctor was saying.
Mhm.
That's not really, it's actually being non-compliant, but it's non-compliant with a reason. It's non-compliant because you didn't know. And unfortunately, what patients fail to realize is that that information goes into your notes. Not, it goes into your portal, but it also goes into your notes. And many patients don't know that there's a difference between the patient portal and the notes. Your notes report everything that you went through at that visit. if you go in there and your doctor says, "Hey, did you take the medicine?" and you like, "No," and you don't give him or her explanation because hey, the language barrier is there. What goes in your notes is that you are a bad patient, you don't follow directions. I mean, all types of negative things get entered into your notes, and that follows you from doctor to doctor. So it's really harmful for you. So if you're going to a doctor and you just don't understand what they're telling you, you hear it, but you don't understand, ask for some help in the office, maybe a management office manager, medical assistant. Ask for them to come into the visit to ensure that you understand what they're talking about. If you don't have access to having someone else go with you to the doctor's office, but whatever you do, do not let language. You just heard it from a senior subject matter expert. What can happen when you let language interfere as a and serve as a barrier to you truly receiving optimal health care by following the information that your doctor is giving you.
And
Thanks,
I
Dr. Jim. Go ahead.
Yeah, I would also add to that too, just to ask questions to doctors because a lot of people might feel intimidated to, ask about ask questions about particular recommendations they might give, particular medications they might be prescribing. I would just say to definitely ask questions, especially if there's something that you don't understand, because doctors, trained in medicine, they're always using a lot of jargon, and the layperson may not understand a lot of that jargon. And this is someone who could be proficient in English, but just not understanding a lot of the jargon. And so definitely it's important to ask questions and get clarification from the doctor about maybe a diagnosis or medication options, even because there are always other options in terms of medications as well. So I always ask about particular medications and side effects. So
Thank you so much. And that ties into that language barrier. So
mm.
thank you so much. My next question to you is this. Can you give three examples of hospitals or doctors using cultural traditions to help people feel better or help patients feel better?
Yeah, so there's an interesting case. The University of New Mexico Hospital actually offers traditional Navajo healing ceremonies. And so that kind of places, culture in the center and then looks at the context of the Native American community in that particular area. So they actually pair these Navajo ceremonies along with Western treatments to be a little bit more sensitive to some of the patients that they support. There's also a hospital in New York. New York is a city of many different people coming from all over the world, immigrants, and so this Bellevue Hospital actually integrates some Tibetan medicine practices in some of their treatment sort of things that they do in terms of meditation, even some herbal remedies for the refugee populations. So people that are coming in as refugees. And personally, as someone who has created a skincare line as well as a wellness program, using some of the traditions from around the world, what we have done with Anthropologic is to try to pull together a lot of the medicinal treatments, and especially in terms of our skincare products. So we look at different ingredients that are being used medicinally on 6 continents around the world, and to see what has actually been effective and time tested and used by these different cultures, and combine them into the skincare line. And so we have heard a lot of positive feedback. Over 95% of people surveyed that have used our products have really seen an improvement in their skin. And so we're getting a lot of positive feedback from people on using some of these traditional sort of healing resources that we combine even into this product line. And that's, definitely something that we're happy to see in terms of how it can really help people.
Thank you so much for that. And personally speaking, I do have medications that I have to take because of some of the health conditions that I actually have been diagnosed with. but I also incorporate a huge part of supplements into my system as well. And some of them very same supplements have been very beneficial to me. Now, I will say that, yes, indeed, in fact, in, uh, I have a traditional medical team. So I have a primary care doctor, I have an endocrinologist, I have a nephrologist to help me with some of the health problems I have. But I also have a trained nutritional functional doctor that helps me with the supplements. So they work together, and understanding, okay, well, this is what one does and this is what the other one does. I'm going to caution you, if you are looking at traditional functional medicine, please ensure that the functional medicine doctor that you are going to is certified and knows what, has went through courses and has been trained to do this. There are a lot of nutritional functional doctors popping up now on the internet. Some of them haven't even finished high school, but they're actually able to go into the field and they're actually able to serve as nutritional functional doctors. So, is supplements good for you? I say, because personally, I do take them along with my regular medications. They are helpful, but once again, the functional medicine doctor that I see is licensed and she's certified as a pharmacist. So that means she studied the supplements that she's given and she's not just willy-nilly giving me things. So culturally speaking, you have to be aware of who it is you're seeing and what background they have, what licenses they have, what experience they have. Don't just go and say, okay, well, you know what, I'm trying this, and you don't know who or what you're doing, because that hurts you. So so thank you very much for that, Dr. Tramayne. My next question is this: what problems can happen when modern medicine and traditional or native healing methods don't agree? I just addressed it a little bit from the personal side, but from the clinical side, can you address that for us, please?
Yeah, definitely. I mean, there could be delays in treatment when there's sort of a clash of different cultural perspectives there. There could be feelings of that person's culture or tradition not being respected when the Western model is sort of forced upon them. And then there could also be a lot of non-compliance between someone who is more focused on using their traditional methodologies versus the Western medical sort of interventions. And actually, there's an interesting case of this that I studied in graduate school. There's an ethnography written by Anne Federman about the Hmong, which is a community that is originally from southern China, an ethnic group that migrated to Southeast Asia. And they have a belief that, and the ethnography was called "The Spirit Catches You and You Fall Down." They have a belief that when someone has epilepsy, and they call it a spirit possession sort of episode, when someone is possessed in their perspective by the spirit, that that could give that someone the potential to become a shaman or a traditional healer. So they don't necessarily view like an epileptic episode as a negative thing from a traditional cultural perspective, especially when this ethnography was written. So the ethnography was, which is just basically an anthropological um, sort of description of a cultural phenomenon. When this book was written, it focused on the Hmong family and sort of their clash with a Western traditional hospital, with their daughter being admitted into this hospital for epilepsy, and the cultural misunderstandings around them wanting to use traditional sort of Hmong healing methods in terms of her epilepsy, and even being non-compliant in some of the medications that were prescribed to her by the doctors in terms of treating the epilepsy. And so there could be a lot of these issues that arise when there's sort of this conflict between the Western modalities of doing things and more traditional methods, especially if it's something that's really ingrained culturally within a particular group. So that's something that, we could see there being a conflict. In other ways, I think that there could also be a complementary sort of relationship between Western medical practices and some of the traditional practices. And so I think it's important for instance, for treating some of the chronic diseases like hypertension and people having to be on medication for that chronic disease. In addition, following some lifestyle habits that they can change, they can actually um, improve the outcomes of the medication because their lifestyle changes are actually helping their bodies to regulate their blood pressure naturally as well. So I think that is definitely an instance where the traditional sort of methods can complement Western medicine. And like our program, in terms of helping people to manage chronic diseases, we definitely promote healthy lifestyle changes and focusing on some of the teaching people, some traditional methods of healing, stress relief, but also different types of foods that they can eat that can be healing as well and help to improve the outcomes of just the taking them rather than just taking and relying on the medication.
And for that, I say thank you very, very much because you're right. I mean, and we as patients, we have a responsibility to ourselves to have these conversations, to keep what Dr. Tramayne has went over during our video session today, to keep them at the top of our mind, to use language. If there's a language issue and a language barrier, use that to, overcome some of the questions or thoughts you may have by asking for help. And I encourage you, get a journal. I mean, we've published a journal, a personal health planning journal, family journal, but you don't even have to purchase our journal. You can actually go to the dollar store and purchase a book for $1.25. Take that with you to the doctor with your questions already outlined so that you can have them answered. Because I'm going to be really honest with you. Healthcare today is not healthcare. Healthcare today is a business. And as a business, doctors sign contracts that they have to uphold. So imagine going to a doctor and there's a language issue and you don't have your questions written out and you don't understand what the doctor is telling you. You walk away frustrated and not learning anything and not being able to self care, take care of yourself. That self care issue goes right out the window. So be mindful of what she said when she's talked about, what happens when there's a cultural issue. What happens when, even when there's not a culture issue. But what happens when you go to the doctor and, you believe in, taking the herbalistic or the holistic way of doing things, but your doctor is asking you, try medicine. Use your voice to, I actually had to literally fight verbally fight with my doctors from my medical side and from my holistic side to come together and say, Sandra's a patient, we need to make her better, let's work together. But if I hadn't opened up my mouth, it wouldn't have happened. Like they would have been at odds because neither one of them understood what each other was doing when all of them together were trying to make me a healthier patient. Once again, be really mindful of that. Take what Dr. Tramayne is telling you to heart. Take what we've discussed today to heart. Use that as a stepping stone and a guide towards getting yourself better and making sure that you're always able to get optimal health care. It really makes a difference when you get better and when you get optimal health care. Optimal health care makes you want to continue to go. Getting better just is like a layover, a temporarily bandage that you put on. We need you to get optimal health care so that you can get better and keep getting better and keep getting better and keep getting better. before I end, again, I want to remind everyone that we will be having on October 25th our second annual Health and Wellness Summit. This is a summit where we will be discussing 10 various health conditions that impact our community. It will be personal and lived experiences that will be discussed at this meeting. At the summit, it will also be interactive. So we're looking for our audience to actually come and actually share what they're going through. Actually, let us help you get the help that you need or that you know someone in your life needs. Let us help you get that help. There's too many misdiagnoses and undiagnosed health conditions in our community. We've got to stop. We've got to stop. We each have a role to do in stopping it. And so I, as well as Chams, as well as our sponsored partners, are coming together to help you.
Mhm.
Help yourself. The tickets are $5. And once again, there'll be 10 speakers as well as a number of vendors. If you are a vendor and you're in the STEAM field, science, technology, engineering, art, and math, please reach out to me to see how you can become a vendor. So, without further ado, before I end this session today, Dr. Tramayne, can you give us 3 thoughts that you want us to all walk away with that help us become our best cultural healthcare proponent for ourselves?
Yeah, I think one of the main things is to stay sort of inquisitive within sort of the healthcare space. As I mentioned before, asking questions is important of your providers. I think, they're trained in a very specific way. And so it's important to get clarification on issues that you don't understand so that you can advocate for yourself. So stay inquisitive. Also focus on self-care, which is what we do is we help people to focus on self-care um, through using the wellness tools that we create and also the wellness resources. And so that means it's taking time for yourself to de-stress, to relax, and also even to get the information that you might need to better take care of yourself. And that's where we provide our digital health resource, Health and Wellness Academy, to do that. And then I think the third thing I would say is to just really take time to reflect on some of the things that we've talked about, and just take time to think about how you can implement some of these things in your own life in terms of your healthcare visits, in terms of taking care and being more mindful of your own wellness. I think it's just important for us to take time sometimes to reflect, and we're always constantly distracted in this digital world with things going on and information overload. And it's not often that people just take time to reflect and think about, how they can better themselves and focus more on self-care.
And you know, once again, I say thank you for taking the time today to speak with us. Thank you for showing, it's good when, we have clinicians that and providers that say, I care, I really do care. But it means so much to us that are going through the patient experience, whether it's personally or whether it's someone in our family. When we have clinicians that actually step up and say, that they care, but also more importantly, show us you care. Show us that you care. So, and you're one of those that have shown us that you care. You know what, Sandra? There are options, and you're right. A lot of people in our community don't realize those options, don't realize those resources. But I'm here. I want people to know that I'm here. I'm showing my face. I'm showing my name. I'm showing everything, so that people who are like, you know what, but I really want to live this holistic lifestyle, truly want to live this holistic lifestyle, or add it to, like I did, add it to my traditional healthcare. I really want to do this. I just need to know who I can turn to. You actually talk to talk and you walk to walk, and together we, as a patient, I know myself, I so appreciate the care and concern that you show for not just our community but for all communities. before I close, what I do want to do is ask you if you can tell everyone your contact information.
Yes. So our products and programs can be reached and found on our website, which is anthrospa.com. That's anthropspa.com. So anthrospa.com. You can find us on our website. And also, you can contact us if you'd like to submit an inquiry. You can always get in contact with me by submitting the contact form on anthrospa.com. One of the things that we just actually reoffered is coaching services, personal coaching services, in addition to our wellness academy, our digital health academy. So that is something that is a program that can be purchased also through our website. So all of our plans and services and products. I launched last year a book as well to help people to relax and de-stress, which is called Mindfulness Inspired. It's a coloring book for everyone to unlock their creativity and also to relax and relieve anxiety. That is available on Amazon. So you can find that on Amazon as well as our website.
And are you on any social? I know you are, but what are your social media handles that
Yeah.
people can find you on?
So, and we're primarily on Instagram and Facebook. So, at for Instagram, our social media handle would be at Natural Beauty Anthro Spa. So that's at Natural Beauty Anthro Spa for Instagram. And Facebook, you can just look up Anthrospologic on Facebook, and you'll find our Facebook page there.
Okay, so I thank you so very, very much for that. And for those of you that are looking today, that are listening and are LinkedIn fans, she's also on LinkedIn.
Hmm.
So
Definitely.
under LinkedIn, what is your social media handle on LinkedIn?
So you can just find me at Dr. Tramayne Butler on LinkedIn, and I'd be happy to connect with anyone on LinkedIn as well. And I can also be contacted on LinkedIn.
And so, for those of you that are listening, whether maybe you heard this and you're like, I really want to speak to her, but I just really didn't get her information. Please reach out to me and say, hey, Sandra, can you send me her information? I'd love to talk to her, I'd love to speak with her. Could you send me her information? And by all means, I will send you her information so that you have it, because the patient experience is nothing if we don't use the model that I always say, which is each one, reach one, teach one. So if you don't have her information and you need it, please reach out and I'll make sure you get it. With that being said, I want to go ahead and end today's discussion on Speaking with Sandra L, the Patient Experience podcast. I also want to remind everyone, be kind always. It's free. It doesn't cost you a thing, and you never know what you're being kind to someone during the time that you're being kind to them means to them. And you might be like, well, Sandra, some people are just rude. Why should I be nice to them? Because perhaps you being nice to them will bring them back to the reality, and being kind to them will bring them back to the reality that they need to be brought back to, which is that their behavior is unacceptable. But don't let their behavior stop you from being kind. Be kind always. With that being said, everyone, enjoy the rest of your day, no matter whether you're listening at this now, which is 12 o'clock p.m. On Friday, the 8th of August, or whether you're listening to this in the future. Whatever your day is, please enjoy the rest of your day. Thanks, Dr. Tramayne. I appreciate you.
Thank you, Sandra.